Hey everyone, I'm Claire Ellerbach, nurse practitioner from NP for NP's Nurtured Path for Nurse Practitioners. Today I'm going to talk a little bit about dealing with being fired as a provider by your patient. Now, not something you want to think about as a provider, especially as a brand new nurse practitioner, but something to be aware of is this fear of being fired by your patient. The most important thing to keep in mind is that being fired by a patient is not a reflection on you. So I'm going to talk a little bit more about the topic, but that is kind of the main point is that it's not necessarily a reflection on you when a patient wants to fire you and no longer work with you. So let's first talk about why you might be fired by your patient. So maybe your patient did not get what they wanted and wants to see someone else instead. Likely the patient was told something they didn't want to hear, but maybe probably needed to hear, or they wanted a medication that you would not prescribe, likely because it was unsafe in your clinical opinion. When these situations occur, it's easy to go internal and think, I'm a bad provider, I'm unlikable, I don't know what I'm doing, I'm a failure, I'm the only one this has ever happened to ever. But we want to make sure that we stop ourselves from doing this. You're likely a really good provider. In fact, it can be problematic if patients like you too much. You are giving them whatever they want, maybe any and every controlled substances under the sun, but you are a provider for a reason. So let's talk a little bit about your true role as a nurse practitioner. So your job is not to be liked by every patient. You are not in the business of patient satisfaction and giving patients whatever they want. If it were, getting trained to be a nurse practitioner or healthcare professional would not be necessary. Patients would just order what treatment they wanted as they order burritos at Chipotle. Brown rice, black beans, grilled vegetables, lettuce, cheese, salsa, and always guac. That's unsafe, though, and not the direction that healthcare should be moving. So know that being fired as a provider is likely a result of providing quality patient care that ultimately keeps the patient safe. And also know that most providers get fired at some point in their careers, if not a few times. I know that I've been. The next thing to keep in mind is that firing is a two-way street. So know that you can also fire patients. If there is disrespect, if there are many no-shows, if the patient is continually not following medication regimen instructions leading to unsafe practices, even after being repeatedly told by you numerous times, you may need to let the patient go. Sometimes we providers think that we are required to put up with anything and everything that comes our way regarding patient treatment, and this is just not the case. The better you get at depersonalizing being fired by a patient, the less stressed and insecure you feel. It is important to keep in mind taking inventory of patient interactions. So I don't want to imply that any time a patient lets you go or fires you, that it's always the patient's fault. If you are being fired frequently, take personal inventory of your interactions and communications with patients. Are you being abrasive? Are you not listening to your patients? Do you show little respect for your patients? Check in with yourself to see if the patient's response to you is warranted. You can ask a trusted colleague who knows you, their impression of you as a provider, to see if you have any blind spots that you're not catching, but they're able to provide feedback on. But if you are not being fired often, it likely has little to do with you as a person. Take in the information for what it is. A patient is being taken off of your caseload and is preferring to see someone else, but do not internalize it and continue to provide exceptional quality care you are capable of providing. I hope this insight provides a little bit of guidance and relief of stress for you as you continue to provide quality patient care. If you want to learn more about this topic and other topics I cover for NPs in practice and NPs transitioning into practice, you can check out my website at npfornps.com, and I will see you next time.